Hello everyone, so my name is Sian Smith-Lickess and I'm from the University of Bath, and I'm going to present work that we've been doing looking at the role of public consultation data for academic qualitative research purposes. And I'm going to present the qualitative results of a public consultation survey that we were commissioned to do as part of a maternity service reconfiguration in southwest England. So just to give you some background to the work, so around the world, health systems are increasingly put under pressure to reconfigure the organisation of their health services. And this could be driven by financial or workforce pressures, or to improve patient access to services and clinical outcomes. And engaging the public in major service change is a legal requirement in the UK. But often service reconfigurations are controversial, particularly ones that involve closing hospitals and centralising services. And studies have shown that the views of local communities are often in conflict with decision makers, and this potentially widens the gap between expert and public or lay perspectives on service change. In the context of maternity service reconfiguration, again, this is often a controversial issue, and maternity services are often an integral part of local communities. So in this talk, I'm going to present qualitative data from a case study of public involvement in NHS maternity service reconfiguration in the southwest of England. And the proposed changes as part of this reconfiguration included the closure of freestanding midwifery units. So these are midwife-led units in the community that are in a different place to obstetric units. It also involved the creation of alongside midwifery units. So these are units situated on the same site as obstetric units. The proposals also included replacing community postnatal beds with support closer to women's homes and promoting the home birth service. So these proposed changes were subject to a public consultation, and this comprised of a survey as well as face-to-face and public meetings. And the aims of the research project were to explore public responses or reactions to the proposed changes through the large-scale qualitative data set that was generated by the public consultation survey. And then in light of these sort of case study findings, to consider the role that qualitative public consultation data plays in academic qualitative research. The public consultation survey could be completed online or paper-based, and it was called Transforming Maternity Services Together. Information about the survey was distributed via GP surgeries, hospitals, maternity units, community groups and libraries. The survey generated both quantitative and qualitative data. In terms of the qualitative data, there was open-ended questions which enabled people to give free text responses about their reactions to the proposed changes. And to help us to organise and structure the large amount of qualitative data in a meaningful way, we applied thematic network analysis. And this is a technique that seeks to categorise patterns of data at different levels, so basic, organising and global themes. And these networks, which I'll present in later slides, I use web-like illustrations to demonstrate the fluidity of themes from a micro to a macro perspective and how they interrelate to each other. And the global themes represent the core of the network at this very macro level perspective. So now I'm going to briefly talk about some of the quantitative results before moving on to the qualitative findings. So a total of 1,193 respondents completed the survey. 63% were aged between 25 and 44 years. 75% were female. Over half were married and had a university degree. 62% identified themselves as service users. 70% were maternity staff and 5% were other healthcare professionals. So there was over 50% agreement for the creation of the alongside midwifery units, and also for the home birth service. There was 62% disagreement with the proposal to no longer support births at freestanding midwifery units, and 59% disagreed with replacing the community postnatal beds with support closer to women's homes. Okay, so now moving on to the qualitative findings, and in analysing the data we identified 3 global themes that represented the core of our thematic networks, and these were perceived advantages of the proposed changes, perceived disadvantages, and perceived implications. And we observed that people's responses were very much shaped by their own previous birth, pregnancy and postnatal experience, their preferences for different birth settings, their confidence in the ability to give birth, their trust and confidence in healthcare professionals, their perceptions of risk and what constitutes a safe and ideal birth, and also the social cultural context, so the norms and practices within their particular community. So this diagram presents the first thematic network analysis with the core global theme of perceived advantages. And this was developed from 2 organising themes in the green circle. So firstly, recognising the need for change and efforts to enhance choice. In terms of recognising the need for change, this stemmed from 2 basic themes. So understanding the rationale behind the proposal and reallocation of staff and restructure of services. So there was recognition of the challenges that were faced by staff and services when freestanding midwifery units were underutilised, and as such changes in maternity system were welcomed by respondents as they were perceived as important to ensure that the service was efficient and cost effective. The second organising theme related to how the proposal was making efforts to enhance choice. And the alongside midwifery units were viewed as being the best of both worlds. As this service user says, I would possibly feel calmer and safer giving birth in an alongside midwifery unit, knowing that the obstetric team is close by and can do the best for me and my baby. In terms of the promotion of home births and breastfeeding support, so this was welcomed by some respondents in that it helped to normalise the birth experience, and plans to improve breastfeeding were also valued, particularly when people seemed aware of the low breastfeeding rates in the UK. So this is the second thematic network, with the perceived disadvantages of the proposal being at its core, and there were 2 organising themes here. So firstly, choice and features of birth settings and access to maternity services. So in terms of choice, women felt that birth choices would be limited by the proposed changes, and there seemed to be great sadness and disappointment around the closure of the local FMUs, because they'd often had quite a positive birth experience there. Also the concept of intergenerational continuity was raised by women who wanted their children and their grandchildren to give birth in the local community like they had done and keep on that family tradition. In terms of accessing maternity services, women expressed concern around having to travel longer to centralised services and the potential stress that this was caused during pregnancy and labour. And they also spoke of the closure of FMUs as creating a postcode lottery whereby women in those areas wouldn't have access to local birthing services, thereby limiting their birth choices. And this seemed to create feelings of disadvantage and discrimination. So the third thematic network centres on the perceived implications of the proposed changes, and these related to the quality and continuity of care, and also safety, risk and convenience. So there were doubts raised about the transformation plans as to whether women would be able to see the same midwife throughout pregnancy, labour and postnatally. And there were concerns that removing the postnatal beds would have adverse implications for breastfeeding support and maternal mental health. So as one service user says, the FMU in Town A let me stay and be supported through breastfeeding trouble. Taking local support away will only increase postnatal depression through feelings of isolation. The second organising theme, which centred around safety, risk and convenience, there were concerns that the closure of the FMUs conveyed the message that childbirth needs to be normalised, and that women having to travel further to centralised services would discourage them from attending hospital because they feared that they might be told to go home and they'd be travelling back and forth to hospital. So in terms of the outcomes of the public consultation, the proposals to close the freestanding midwifery units and create alongside midwifery units were approved by the clinical commissioning groups. However, the closure of the community postnatal beds was delayed by about 12 months, and this was to enable women, local communities and staff to co-create their own community postnatal model of care. And this decision was largely informed by the qualitative feedback that was received as part of the public consultation around people's concerns about the implications for breastfeeding and also maternal mental health. So I'll firstly discuss the findings of the maternity case study. So I think this work contributes to our understanding of public perspectives to reconfigure maternity services, and it provides further support for the perceived role that freestanding midwifery units play in the local community and how their closure represents a loss for the wider community. It also provides evidence for their role in postnatal care in terms of reducing feelings of postnatal depression and the role that they play in supporting women in breastfeeding in the early days of having a new baby. It also highlights how alongside midwifery units represents the best of both worlds for women and a balance between medical and social models of maternity care. So in light of the case study findings, it's important to consider what role public consultation data could play in qualitative academic research. So there's increasing pressure to reuse secondary data, and academics could seek to access qualitative consultation data through NHS collaboration, as we did, or access it retrospectively. And I think this provides a unique opportunity to both generate new knowledge by addressing specific research questions and also developing new theory in the wider context of service reconfiguration. Also help to develop a better understanding of what local communities want from health services. And I think academic research arising from data analysis could help to facilitate meaningful dialogue between those who are initiating service change and members of the public. And leading on from that, I think future research, it will be interesting to explore the role that academics play in engaging in public consultation processes. And that can be looking at perspectives of academics, commissioners, health service managers and service users. Thank you very much for listening. If you have any questions on the presentation, please feel free to add them as a comment below the video, or also drop me a line on my email.